We're visiting with Dr. Stephen Langer, who is the author of Solve the Riddle of Illness. How does fibromyalgia and low thyroid figure into each other?
As you, I'm sure you're well aware, and maybe some of the viewers may be aware, fibromyalgia, which is considered an autoimmune condition, and clinically, the way it clinically manifests is that there are painful, tender spots in the muscles all over the body, and it's usually accompanied with joint pain and with depression and chronic fatigue, which are basically all symptoms of low thyroid function. Okay. Again, fibromyalgia does exist, the same way chronic fatigue syndrome does exist, but it does not exist in nearly the numbers that it's diagnosed. Because if a person comes in with generalized malaise and painful spots all over their muscles, and the doctors do all of the routine rheumatoid type of workup, and nothing really comes up, and the person continues to complain and continues to suffer, they're diagnosed with fibromyalgia. I mean, it's actually two things. It exists on the one hand, but it's also a garbage can diagnosis on the other hand, where they just said, we don't know what it is, so we call it fibromyalgia kind of a thing. Again, you go to this. My approach is, and I usually see my patients after they've seen the rheumatologist and they've been through the complete workup of their internists, and they're thrown on the prescription anti-inflammatory drugs, which more often than not cause gastrointestinal distress and all the other things that are associated with it. And they just want to feel better. They don't feel good. The two commonest things that I find in so-called fibromyalgia are nutritional imbalances and low thyroid function. The nutrients that most people are depleted in are calcium, magnesium, and vitamin D. I mean, we could do segments on vitamin D alone. There is an epidemic of vitamin D deficiency in the United States. We're doing this now in the Midwest, where where it's dark a good number of months of the year, so people aren't getting sunshine. Most adults do not drink that much milk, nor do I encourage them to do it, but most adults and various ethnic groups are sensitive to dairy products. So for a variety of reasons, people are not either getting sunshine or not getting the foods that have the highest quality and quantity of calcium in it. And consequently, unless they're taking calcium supplements on a daily basis, several times a day, are calcium deficient. That's number one.
All right.
Number two, they're also deficient very often in magnesium, which goes along with the calcium. So, and assuming, for the sake of argument, that they are getting the calcium, magnesium they're needing, there's an epidemic of vitamin D deficiency. It's been recognized in the United States, and this is by mainline medicine in the last 2 or 3 years, that all of the testing that was done for vitamin D was wrong. The range of normal for vitamin D, for 25-hydroxyvitamin D, which is the standard blood test for vitamin D, up until about 2.5 years ago, was about around 8.5 to 40 to 42. Forget what that means, but the numbers that they were hanging their hat on was 8.5 to 42. The new range is 32 to 100. So they were off by a factor of 400% on the bottom end, and 250% on the top end. So for all this time, people who did get tested, which are few and far between, and anything above 8 was told to be normal. Now it's 32, and 32 is considered the low end of normal, but as we've discussed with thyroid function, it's not optimal. A person should be in the 40 to 50 range in order to be optimal. And what that means is if they are not getting optimal vitamin D, among other things, but importantly, is that even if they're getting calcium in their diet, they are not absorbing their calcium.
Because of the vitamin D.
Because of the vitamin D is absolutely, it's not only essential, I mean, it's essential, and that has implications, obviously, not only for muscles, it's necessary for every muscle in your body, including heart muscle. so people can actually develop arrhythmias because they're not getting enough calcium to support their heart muscle. But calcium is also essential for the nervous system. In other words, people have a variety of nerve complaints, and it's also obviously important for the joints because there is, again, an epidemic of osteopenia, which means thinning of the bone,
Right.
and osteoporosis, which means that the bone really becomes porous and very often can't carry the weight of the person. So I mean, a person should make absolutely certain if they have musculoskeletal symptoms that they're getting an optimal amount of calcium, which means for most people taking a nutrient along with magnesium. They should get their vitamin D tested, 25-hydroxy vitamin D, which I test on all of my new patients. Everybody who comes in gets a vitamin D test, and they should get their vitamin D adjusted, so that's optimal. And none of the nutrients are as beneficial as they could be if the thyroid is out of balance. Again, thyroid hormone controls the metabolic activity of all your cells.
As you say, yes.
So on a cellular level, the cells are able to utilize these nutrients much more effectively if the thyroid is properly controlled than if they're subclinically hypothyroid. And the bottom line of all of this is very often, I mean, people who've come in and complain of years of fibromyalgia symptoms, and this includes, and we're not only talking about fibromyalgia, we're talking about restless legs at night.
Okay.
And there's a new drug on the market that actually is a blockbuster drug, and it's being advertised all over TV for restless legs. Just about every case of restless legs I've ever seen is accompanied by a low vitamin D and not enough calcium, magnesium. So I'm not saying that you never need to use the drug, but what I'm saying is before you take a drug, make sure that all of your nutritional status is checked and that it's optimal, and make sure that your thyroid status is optimal. And very often, again, as with so many other systems in the body, a person is put on optimal nutrients, optimal amount of thyroid function. People that I've seen who complained of fibromyalgia symptoms sometimes for 5-10 years get better in months when that is the cause of their problem. And it really is simple. If that is not the cause of their problem, I'm not trying to tell everybody that it's all nutritional. There are autoimmune and there are other factors that we don't know about. Then they can go to the rheumatologic workup and get on the anti-inflammatories and the drugs, which will bring temporary relief, but are not curative. But always check your nutritional thyroid status first and take care of that. And most people who do that and find that that's a problem have great relief in a very short period of time.
So there is hope for the suffering of fibromyalgia. A lot of what you're saying
absolutely help. I'm not trying. Again, what I'm giving is a simple solution. I am not trying to oversimplify a complex problem. I mean, I've got to continually reiterate that there are other organs in your body and other systems in your body other than your thyroid. But if your thyroid is off and you're missing essential nutrients, which your tissues need to function, they're not going to function properly. And that should always be the first unless you have an acute medical emergency, that should always be the perspective that a person takes initially to see if they can overcome clinical problems that they're having.
Okay, well, thank you very much, Dr. Langer.
Pleasure.